parents, many of you are living under the fear of one word, epilepsy. But first, it is important to understand that not every twitch, jerk, or fit-like episode in a child is epilepsy. Many times, parents read something on Google or hear opinions from others and immediately conclude that the child has epilepsy. Then they go to a pediatrician and say, "My child has epilepsy." Doctors often have very little time, and medicines may be started quickly. However, the reality is that every child who appears to have fits does not necessarily have epilepsy. Once anti-epileptic or anti-seizure medicines are started, many children become excessively sleepy and inactive throughout the day. If a child's brain remains in a sleepy state most of the time, how will the body and brain develop properly? How will the child express hunger, thirst, discomfort, or emotions? Often the child turns the face away while eating, and parents force feed, which later creates digestion issues. Please pay attention to one very important thing. Many times, children experience distress because food is being given while they are lying down or sleeping in someone's lap. Do not feed a child in a lying position. Always feed the child in a sitting posture. If the child can sit on the floor in a Buddha posture, let the child sit there. Otherwise, use a beanbag or supportive sitting arrangement. This allows food to travel properly into the stomach and reduces the chance of food entering the respiratory tract. Just imagine, can you comfortably eat food while lying down asleep? No. Then why should a child be expected to do so? Sometimes the child struggles for breath because food or secretions are affecting breathing, but parents assume the child is having seizures. Panic starts, medicines are increased, and the child suffers even more. I fold my hands and request parents, never start anti-epileptic or anti-seizure medicines. Never give these medicines to child. Many children also come to us with visual problems. Sometimes parents hide the fact that the child cannot see properly, but we understand it during observation. Often ophthalmologists explain that the eyes themselves may be structurally normal, but the connection between the eyes and the occipital cortex of the brain is not fully established. Many children improve significantly through continuous Vasa concept exercises. We have seen many children who were once considered blind later begin to respond visually and see much better because their parents worked consistently and sincerely. Parents of children with visual difficulties must not lose hope. With dedicated work, stimulation, and proper guidance, improvement is possible. Speak to parents who have worked regularly with their children exactly as instructed by us and have seen positive results. If your child experiences frequent fit-like episodes, one important supportive technique is deep chest pumping exercise, which our team will teach you. With chest pumping, brain receive adequate oxygen. Along with this, keeping the child in an upright seated posture throughout the day instead of constantly lying down is very important. Lying down for long periods and feeding while lying down often worsens many problems. Parents also need to understand another important issue: contractures. Many older children come to us with severe stiffness and tightness in their muscles and joints. Parents tell us they did passive movements every day, visited therapists regularly, and still the contractures remained. Eventually they are advised splints, Botox injections, or orthopedic surgeries. Yet even after surgery or plastering, contractures often return again as the child grows older. Think about it carefully: when the child was 6 months old, 1 year old, or 2 years old. The body was not so stiff and twisted. But as standing and walking training begin without proper preparation, scissoring of the legs and severe tightness may develop. Over time, even cleaning and daily care become difficult because of tight adductor muscles. Then repeated surgeries and painful procedures continue throughout childhood. Our goal should not be to increase pain in a child's life. Our goal should be to reduce pain and help the child experience happiness and childhood naturally. The exercises we teach are focused on helping the child's brain and body connect properly with gravity and movement. When the brain learns how to connect with gravity and movement naturally, the body becomes freer, movement improves, and contractures can often be prevented or reduced without relying only on splints, Botox, surgeries, or excessive medications. Movement is life. Healthy children constantly move, crawl, play, explore, throw toys around, run, and enjoy their environment. Children with developmental difficulties also deserve the chance to experience childhood joy, movement, and play. If a very young child comes early, at 1 or 2 years of age, many complications can often be prevented before they become severe. Then there may be far less need for surgeries, Botox, splints, or restrictive interventions later in life. Every child deserves to play, smile, explore, and live a joyful childhood. Our dream is to see children enjoy life and to bring smiles back to the faces of parents. My only wish is that the children who come here to RVF should play, laugh, enjoy themselves, and truly live their childhood, while bringing smiles back to their parents' faces. I invite all of you to join hands with me so that together we can help children across the world heal and improve their lives. We also want to prepare and inspire a new generation of young doctors and caregivers who can continue this mission with dedication and compassion. There are still countless children around the world who are suffering and crying in pain. Together, we can help reduce that suffering and bring hope to families everywhere. And in this mission, India can lead the world because the answers and solutions we have are not available anywhere else in the world. So let us all come together, and let us change the world.